With Amare. So today we're going to talk about cancer recovery. Now, cancer is a very sensitive topic, but also a very confusing topic because after cancer, your doctors, your surgeons, your radiologists, all these people check in on you, tell you you're good, tell you you're fine. Breast cancer is what I specifically want to touch on. We specialize in breast cancer recovery. What does that mean? Lymphedema. The trauma from radiation, your body's still breaking itself down because of all of the chemo and the drugs and all of that. A big part of getting past cancer is the actual recovery. So yes, it's emotional, but it's also your body. Your body took a huge hit. Your doctors did everything they should have. They saved you, they got rid of the cancer, and you're good to go. But this also plays into the whole staying in remission thing. So you do chemo, you do radiation, you fry your body, you kill it full of drugs, and you kill the cancer. Great. Afterwards, they're like, okay, you're going to heal, you're going to be fine at the end. Breast cancer specifically, one of the things that happens, or if you have cancer in your lymph system, in your lymph nodes, and those get removed, your system is now broken. You're forever immunocompromised. You do have a chance of lymphedema if you don't already have it or have developed it. And that can be really confusing because even the lymphedema specialists in the hospital aren't really that specialized. They're kind of like, okay, here's this machine that insurance is going to give you, and insurance pays for it, but it's like some machine that squeezes you that has like air compression in it. Doesn't really do much for you because it's just pushing fluid around but not engaging your body to actually suck it back. It's not retraining your body what to do with that fluid. So there's that. They also do their compression wrapping with bandages that are too elastic, and they don't really explain how it works or why it works. Sometimes they don't even teach you how to wrap properly, and then it's uncomfortable. They'll give you a medical grade compression garment, which works but not really because it's not custom tailored to your body at your baseline. It's tailored to your body where you're at with all the swelling, which helps, but then what happens when the swelling goes down and that garment doesn't fit anymore? So I've had a lot of cancer recovery patients in my career. I've had a lot of them this week. I've had a lot of them this month, and a lot of them, the doctors don't teach you how to do anything. They save you, they get rid of the cancer, that is their job. Their job is done. Now you have to recover. So changing your diet, changing your lifestyle, rebuilding your cells, rebuilding your tissue, and making sure that your body's not susceptible to getting the cancer again. So one of the things that causes people to get the cancer again is the toxin buildup. So if you've never cleaned it out from the radiation, from the drugs, from the medicine, you may even have to be on medications after the cancer's gone, and that constantly needs to be cleaned out of your body. That way you can stay healthy so your cells don't start metastasizing again and your body doesn't start attacking itself again. Any kind of buildup will contribute to that. So smoking, alcohol, bad foods, all of that lifestyle stuff. So that is a huge trauma that happens in your life that has to trigger a lifestyle change. And if it doesn't, you could have a chance of it coming back and you may never fully recover. That aside, breast cancer, ovarian cancer, pancreatic cancer, cancer in the lymph nodes. Those are major things. And what happens with that is, again, your body gets destroyed, and then they're kind of like, all right, you have lymphedema for the rest of your life. The end. Like, you're just going to forever be swollen. Or they'll, even worse, tell you, oh, you're swollen, but it's fine. Like, it's not that bad. You're fine. And you're like, dude, I can't live my life normally. Like, I've got all this swelling. I've got all of this pain still. Like, my skin hurts and I don't feel good. I still feel like I have something wrong. Well, you do. It's all those toxins and all that buildup and all the damage in your body that never got repaired. So what we do at Amare is obviously the lymphatic drainage. We get all of that swelling out of you. We get all of the drugs out of you. We get all of the bad stuff from the radiation and everything that happened out of you, and your body starts rebuilding anew. So yes, there's the detoxing, but there's also the cellular repair, and there's also the immune system repair that needs to happen. So you have to take care of your body and clean it out, yes, but also having a specialist like us that can look at your whole situation, look at the medications you were on, and say, okay, here are the detoxes we think you should do. First of all, MLD. Manual lymphatic drainage. Clean your whole body out. Do a couple consecutive days, either 4 or 8, depending on where you are. Second of all, compression, making sure that swelling goes down and doesn't come back. And that is individual to everyone. Like I said, if you've had lymph nodes removed, your body is forever compromised. You're going to have lymph issues. That doesn't mean it's going to have to affect the quality of life forever. You can have a normal life. You can do what you want to do. You can be active. You can be out in the sun. You can have salt, but you have to make sure you're wrapping. You have to make sure you're taking care of your lymph system, and you have to understand that this is something that is a life work now. Like, you're always going to have to be okay with this and make sure that you're taking care of it. But that doesn't mean it has to be some crazy thing where you're hooked up to a machine the whole time, where it's pumping you 3 times a day just to manage the swelling that you have instead of just getting rid of it. So finding a specialist that actually specializes in manual lymphatic drainage for cancer recovery is a huge thing. Now, that's after cancer. What happens when you're going through cancer? We do the same thing. So there's something in radiation, especially with the breast tissue and the chest area, called axillary web cording, or radiation fibrosis, I think it's called, which is where you start to get fibrosis, thick, hard scar tissue that starts to build up because the lymph in that area is sitting stagnant and constantly being fried, and it's not moving. So the radiation is causing a buildup of fibrosis or scar tissue. As that's happening, we can take care of it to stop it. Same thing with the hair loss. Same thing with all the things that your body's going through. The medication works, but it destroys everything. So if at the same time as we're working with the medication, we're making sure that we're cleaning everything up and keeping things healthy and keeping things flowing and keeping things running, whether that be with actual hands-on lymph drainage or at-home stuff that you can do, or compression or foams, whatever it is, we can stop that from happening to begin with. So it makes the chemo work better. It makes the drugs work better because your system is clean and processing at a higher rate. It saves your organs from all the trauma, and you don't have to do the cleanup work as much after recovery. You're still gonna have to recover, but it shouldn't be after cancer. Cancer is the recovery. That is your body recovering from all the stuff it's been through that has trashed it for however long. Now, sometimes cancer is genetic. Sometimes you can have the healthiest lifestyle in the world and run and work out and eat super clean and still get cancer. But again, that's still your body trying to recover from the cancer itself. So during the actual treatment, you should absolutely be getting support. You should be doing acupuncture. You should be getting lymph drainage. You should be changing your diet. You should be doing all of these things during the process. Now, yes, you are exhausted. Yes, you've been to a million doctors. Yes, it can be extremely emotionally draining and traumatic. But having a support system that has a plan for you, that's not just, okay, we're going to do chemo and radiation and cut away at your body, you're going to heal, you're going to be fine. Having something that's actually progressive for your body the entire way, including after the cancer's gone, including after the surgery. Because again, at Amare, we're plastic surgery recovery specialists. Like, that's what we do. But it's all surgeries, and cancer removal is a surgery. You're getting cut. Your body's still going through trauma. So yeah, that's going to affect you, and it's going to affect you even more because it's deep internal stuff. Plastic surgery can be on the surface. Lipo can be on the surface. It's between the layers. When you're talking about an organ, when you're talking about a knee replacement, a hip replacement, lymph nodes, things that are deep in your body, you're going to need something a little bit more than just a few MLD sessions and you're good. But we deal with all of that. So finding someone who's actually had experience dealing and treating breast cancer recovery, ovarian cancer, pancreatic cancer, again, cancer in the lymph system where they're removing lymph nodes, which can be a huge problem with lymphedema. And a lot of people are lymphedema specialists and teach you how to treat it, but nobody teaches you how to prevent it. And that's what I do, is talking about it beforehand, is the prevention of developing lymphedema. Now again, sometimes it has to be cut out. There's no choice. But that doesn't mean that at that point we can't minimize it as much as possible to where you won't even have swelling symptoms, because your body during the process is being taken care of, so it doesn't have that trauma response, and then we don't have to worry about cleaning it up later because you'll already be taking care of your body. So the first step to cancer recovery is treating the cancer holistically, not just with the drugs, not just with the radiation, not just with the chemo, but at the same time as creating a plan to make sure it doesn't come back, treating your body and fortifying it and strengthening it so it can go through the process of getting rid of the cancer without having complications, without having all this extra stuff, and then healing your body and getting back to normal, if not better than normal, after everything is healed, after the cancer is gone. Making sure that the swelling stays down and doesn't come back. Making sure that you don't develop lymphedema. And you can develop lymphedema even from something like pancreatic cancer, or heart failure develops lymphedema. It's a very common thing where you swell and your lymph system doesn't recover properly. There's primary and secondary, and we've talked about this. With cancer, it's generally secondary, which means that it's because of a thing. It's because of the cancer that you're swelling, you're blowing up, you're gaining an enormous amount of weight. The drugs will also cause that. Radiation will fry your lymph nodes, and then you don't have lymph nodes anymore or vessels to suck that fluid back into your body. So there are a lot of things that goes into this, but this is just a short video to explain to you guys what we do as far as cancer recovery. If you are not in New Jersey and you cannot get here, I do virtual consults for this reason. You can still get support. We can still have a plan of action. We can still talk about it. And yes, there are tons of different cancers out there, and not every cancer is the same, and not every person is going to have the same stage or have the same recovery or have the same cancer, even if it's the same organ. So it's very, very individualized. It's very personalized, which is why I do the virtuals and I spend time with you guys figuring it out. So I hope this video was helpful. This will go up on our IGTV on Friday. And if you have questions, feel free to call our office and DM us, but we're just going to tell you to call the office if you DM us. So feel free to call our office, talk to the girls, ask questions, and I will see you guys soon. I hope this was helpful. Have a good rest of your day. Bye.